Hello everyone, welcome to FACT series, Facial Assessment with Clarius Technology. We are exploring the importance of ultrasound guide in facial aesthetic treatments that combining precision, safety and artistry. I'm Dr. Roya Zarmezamin, and today's session is about assessing and exploring different layers of the skin. Why is it important to see and assess and scan the different layers of the skin? Because of check the patients for any aging process of the skin that damage the skin versus intact skin, and tailor the customized anti-aging treatments. Before we are going to start this scan, I'm just reviewing just a brief review of the anatomy of the skin and subcutaneous area. As we know, the outermost layer is the epidermis, then below that we have upper dermis, then lower dermis or reticular dermis, and then below the skin is subcutaneous fat. The echogenicity and the thickness of different layers of the skin as well as superficial fat, it's very important to choose the precise and the better treatment for the skin. If we see sign of aging, we can decide how to pick the best treatment for unique patients. Now we're going to scan the layers of the skin, and I'm using Clarius L20 because I need the highest frequency to see the most superficial layer. This is the linear probe, and I'm starting in the cheek area and using the dermatology preset. Clarius AI just made this different preset to make it user friendly. Then I'm using dermatology to focus on the skin. Very important point is to scan with zero pressure. That you see on top of the image is the black area, which is ultrasound gel. Then just below that, that's the outermost layer of the skin, which is epidermis. Epidermis is hyperechoic linear structure, and then below that you see the hypoechoic upper dermis, then hyperechoic deep dermis because of the density of collagen and elastin, and below the skin you see the subcutaneous fat, which is hypoechoic with hyperechoic septa, which separate the fat lobules. Now, if I'm going to measure the thickness of the different layers, I'm measuring this way. Just a little back to see the best, because you can easily see the best resolution and best quality image here, which I'm seeing 0.07 millimeter for epidermis, which is normal. Usually is 0.05 to 0.1 millimeter in this area. Then upper dermis, which here is 0.5, 0.51, and then reticular dermis, which is here, is 0.2. Then I'm measuring the subcutaneous fat, which is 6.2 and is good for this area. Now I'm going to scan the other side of the face to show and see if there is a sign of a little bit damaged skin, maybe photo damage, and to see the SLEP, subepidermal low echogenic band, an echoic area just below the epidermis or between epidermis and upper dermis. Let's go to the other side. zero pressure, and a slightly small, very small, patchy area. Let's go back. Very small, patchy, black area here below the epidermis. It's not we cannot say that it's a very damaged skin. Maybe with some anti-aging treatment, or just maybe it's because of the dehydration or a little bit damage with sun. We can just customize the treatment. My goal was to show you how you can use the ultrasound to tailor the treatment, the anti-aging treatment for your patients. Even the depth of the needle that you're using, even the depth of the releasing energy with energy-based device, or even if your patient doesn't need any anti-aging treatment, only volumizing or a little bit, repositioning or any other treatment that your patient is looking for. Thank you for joining us for this session, and stay tuned for the upcoming episodes.